Kelsey-Seybold Clinic tops the list of Texas physicians nationally recognized for excellence in diabetes care. That's because Kelsey-Seybold has achieved the highest level of certification for excellence in diabetes care in Texas, a distinction awarded by the National Committee for Quality Assurance, or NCQA.
What NCQA is, it's the National Committee for Quality Assurance. It's a national organization that looks at medical care and determines measures on how to measure quality of medical care. When it comes to diabetes, the thing about diabetes, it's a very important disease. It's very common and it's also very deadly. And part of the problem with it is that people can have diabetes for a long time and never even know it. Or even after they know it, they don't really feel bad. So a lot of diabetes is involved with establishing a relationship with a doctor so that eventually you'll believe what the doctor is telling you and hopefully take the medicines and do the testing.
In Texas, Kelsey-Seybold Clinic has the most NCQA physicians of any other healthcare provider statewide.
I think a doctor who has gone through the effort of getting any NCQA accreditation in diabetes, I think what that shows is that he or she has gone the extra mile and is really paying attention to their patients, establishing good relationships so those patients do come back, doing the right testing, prescribing the right medications, and achieving a pretty good milestone as far as excellent care of diabetes.
At Kelsey-Seybold, patients, including Leallia King, can be reassured to know they are under the high-quality care of an NCQA-certified physician.
My life before diabetes was one of lack of exercise, very rushed, no exercise, not eating correctly, not doing anything correctly really to take care of myself. I went for my regular appointment here at Kelsey, and 2 or 3 days later the doctor called me saying, "I need to start treating your diabetes." Well, I was in denial at the time. I said, "What do you mean diabetes?" Anyway, so then I started dealing with the diabetes, you know, first one pill, then a second pill, and then a third. And at this point in time, I still take the same 3 medication, but it's under control. I keep an eye on it.
With Miss King, she's a great patient, terrific person. I've been seeing her for many years. She's very easy to work with. Frankly, she comes in and listens to what I say. We're able to have good discussions about her diabetes, and we've been able to get her blood sugars under control with a couple different medications. She also, we have to use medications for blood pressure, and that's also one of the NCQA criteria for getting the blood pressure down. She does come in for the testing that we need to show how her blood sugar's been doing and how her kidneys are doing and those sort of things. But it is important, even patients that are under good control and have been, you just never know when something's going to happen and the diabetes or blood pressure or cholesterol is all of a sudden going to go out of whack. So the follow-up with those patients is very important, and we do touch base usually about every 3 months or so to make sure everything's still going okay.
Over the next 25 years, the number of Americans with diagnosed and undiagnosed diabetes is expected to soar from 23.7 million to 44.1 million, nearly doubling.
I think if I was a patient and if I had a choice, I certainly, and I had diabetes, I think I probably would steer towards the doctors who have gone through that extra effort to get certified by the NCQA.